My name is Elizabeth Schrader. I'm a teacher with the Los Angeles Unified School District. I was shopping at Home Depot on a lunch break, and a metal cart load of bricks, it had about a quarter ton of bricks in it, fell on my lower right leg. And an ambulance came, took me to St. Joseph's emergency room. I sat there for a couple of hours, and then someone came in and said, "We don't have anybody that can see you today, so you have to go to a doctor's office tomorrow." And I said, "What? You would send somebody home like this?" Because I used to be a nurse, and I could look at my leg, and I knew how horrible it was. And they said, "Well, to be really honest with you, nobody at St. Joseph, none of the doctors here will take your case because your insurance does not pay enough." I was appalled. I thought this was what insurance was for. I assumed that if you had insurance, it meant that no matter what happened, you would be treated.
I'm a forklift driver, and the company only offers low medical benefits. I've had an abscess for several weeks now. I'm here today to get some work done on my tooth. Okay, which stage am I in?
Boy, you need a root canal. That's about over $2,000.
$2,000? What sort of insurance I have now is not enough to cover the entire bill. It's really hard to get enough health care to survive and be healthy.
Many Americans believe that we have the best health care in the world. The fact is, the World Health Organization ranks the United States healthcare system a dismal 37th. That puts us between Costa Rica and Slovenia in overall health system performance. We spend twice as much on healthcare, but we are sicker than any other developed country. We don't live as long. Our babies die at twice the rate, and more of our mothers die giving birth than in any other industrialized nation.
There are many health indicators in the U.S. that are far worse than other countries that spend much less per person on health care than we do. So it's not about how much money we spend, it's how we spend the money we have. If we eliminated the waste and redundancies in our system, we could spend less than we do and still provide everyone with quality, comprehensive care.
A senator in California has introduced a solution to this problem.
Because our healthcare system is the most expensive in the world and provides substandard care, we've introduced a plan creating a single-payer, universal health insurance system that saves money, covers everyone, and gives Californians access to the modern, high-quality care they deserve. And polls show that this is what 2/3 of the voters want.
It's called California OneCare, and it will mean full care for all for less. Nearly half of the U.S. population has inadequate health insurance coverage, and nearly 20% has none at all. At the same time, we are awash in health care plans, more than 6,000 in California alone. But few of them offer real choices when it comes to actual care. Decisions about your care are often being made by insurance company clerks with inadequate medical training and no accountability when they make medical mistakes. It's the insurance companies who decide which doctors you may see and when, or what medicines you may take. They decide whether or not you may see a specialist, or what diagnostic tests you'll get. Insurers dictate how long you may stay in the hospital, if at all, and how many therapy sessions you may have. And that's for the lucky ones who have health insurance. In California, 21% do not have health coverage, even though most of them have jobs. They're the ones who wait until their condition is acute and have to go to an emergency room, or skip medications because they're too expensive, or who tragically join the 22,000 people who die every year for lack of health insurance, now the 7th leading cause of death in the United States.
Nurses are on the front lines of healthcare, and we see the impact of our broken system every day. Decent, hard-working people suffering because they can't afford their medications, or skipping surgery because their health plan excludes it, or dying from chronic conditions because their coverage is canceled. This is a national tragedy, and it has to be fixed immediately.
Every other nation in the developed world shares the cost of health care among all of its citizens. By sharing the risk, their governments are able to provide universal health coverage to everyone. To do this, most developed countries use some form of what's called a single-payer system. That means that there's one health insurance agency. Everyone pays into that agency, and all payments are made from that agency to healthcare providers. When it's passed into law, the new act will create the California Healthcare Agency, which will provide all residents of the state with comprehensive health care coverage, including services by hospitals and health facilities, physicians, licensed health care professionals, diagnostic imaging, laboratory services, prescription drugs, dentistry, vision care, mental health care, preventive care, rehabilitative care, durable medical equipment including prosthetics, eyeglasses, hearing aids, immunizations, blood products, podiatry, dialysis, home health care, emergency care, chiropractics, acupuncture, adult daycare, substance abuse treatment, up to 100 days in a skilled nursing facility after hospitalization, health education, emergency or necessary transportation, language interpretation, and hospice care. Under the new system, there'll be no more deductibles, co-pays, or pre-existing conditions.
All you would need to access any of these benefits would be a health care card which every California resident would be entitled to. The surprising thing is we can cover all of these benefits with less money than we're spending now on an inadequate and broken healthcare system.
How is this possible? By eliminating the money wasted on private health insurance. Right now, about 30% of our health insurance premiums go to what the industry terms administrative costs. These costs include mountains of paperwork, sales and marketing expenses promoting various insurance plans, enormous profits for shareholders, and obscenely high salaries for senior executives. The remainder, which the insurance companies refer to as medical losses, goes to health care providers.
If you think the health insurance industry is in business to help you as a patient or you as a doctor, you're sorely mistaken. They're in business to make money for the shareholders.
The insurance industry is doing everything they can to maintain their profits. They're answering to Wall Street, not to the needs of the people.
The 30% of premiums that now goes to administrative costs is more than enough to provide comprehensive health coverage to all uninsured residents in the state.
So that's the key to single payer, is that you'd use the administrative cost savings to cover everyone.
Private health insurance is costing us 30% of every dollar for administration and profits. The federal government in the Medicare program spends 3% on administration. Senator Leno's bill caps administrative costs at 5%. About half of the new system will be financed by government funds that are already being spent on existing public health care programs like Medicare and Medi-Cal. The remainder will be financed by replacing private insurance premiums with single-payer premiums in the form of taxes on businesses and individuals. Because of the administrative savings, single-payer premiums will be less than what families and businesses are paying now for inadequate insurance. We'll pay less and get much more. Another advantage is that businesses will become more competitive under the single-payer plan.
We don't compete just with companies in California. We also compete with companies in Canada, the UK, Australia, and New Zealand. And in those countries, there's a single-payer healthcare system, and therefore, even though the health care in those countries is significantly better than it is in the United States for most people, the cost in those countries is half of what it is in the United States. So that puts us at a distinct competitive disadvantage vis-a-vis foreign countries.
The system that Senator Leno has proposed is a single health insurance system, not a government-run medical system. The doctors, hospitals, labs, and other providers will continue to operate independently as private firms, just as they do now. To make it responsive, the new system will have an accountable commissioner, a policy board that represents the medical profession and consumers, a physician in charge of the overall quality of care, and an inspector general to prevent fraud. Fair and equitable compensation for doctors and hospitals will be negotiated, and there'll be financial incentives for them to provide quality care. Under the new law, you'll be able to choose any doctor you wish as your family doctor. You and your doctor, not a government official or insurance clerk, will decide upon and manage your care.
I've come to realize that the single-payer system is the only way to return responsibility for patient care back to doctors and remove insurance middlemen from the system.
It's a system where everybody wins. First and foremost, patients will get the care they need when they need it. Doctors and hospitals are fairly compensated for the services they provide. It brings rising healthcare costs finally under control. And it covers everybody. No copays, no deductibles, no pre-existing conditions. And it saves money over what we're now spending on our broken system.
But private health insurance is a $400 billion industry, and drug companies are the most profitable business in the nation. With that much money at stake, these firms are not going to go quietly.
No one knows more about the awesome power of the insurance industry than I do. I have been fighting these characters for 20 years, and they have money, they have legislators, they have governors, they've got PR firms. They're tough. But the needs of the people is greater. It's time for a grassroots movement to push aside the insurance companies and say, it's not about Wall Street, it's about our health as human beings. We can change this system, but we have to do it from the grassroots up.
That's the goal of the California OneCare campaign, a huge grassroots movement involving millions of people who demand a single-payer plan that will provide full care for all, for less.
The California School Employees Association has 230,000 members are going to be up front in this campaign for single-payer universal health care.
What do we want?
It's the only real way we can send the message to the nation that single-payer universal care is the only way to go.
The National Education Association and California's teachers support H.R. 676, the single-payer solution at the national level to improve our health care system. But Senator Leno's single-payer bill will bring true health care reform to California right now. That's why we're actively involved in the California OneCare campaign.
It will be politically feasible in the very near future as this mass movement surfaces. And the way it will surface will be when the media catches up with what the people want.
When you think about a basic right, health care has to be one of them. I don't believe it's a privilege, it's a right, and government, the private sector, all of us working together need to solve it.
The healthcare system we have now is unfair, expensive, and dangerous. The California OneCare plan that we've proposed would give Californians what they want: universal comprehensive health insurance for everyone for life.